All right, I'll just wait a couple of minutes for some people to join and then I'll begin. Hi, Natalie. All right, I think I'll begin now. So hi everyone. My name is Matilda, and I'll give a bit of an introduction today before I begin. So this is my first live video. I'm very happy and excited to be here. So a bit about me. I grew up in Sudbury, Ontario, Northern Ontario, nice and cold. But I'm currently a first year medical student at the University of Ottawa. So big change, it's a much bigger city, but I'm really loving it here. Um, and so today we are going to be talking about allergies, especially in children, and I'll talk a little bit about how you develop an allergy, how to recognize, the symptoms of someone who might be developing an allergy, how to treat them, and its prevention. And this is a particular special topic to me because I actually grew up with several allergies and developed them at all different ages, and I have a lot of experience with them. So I'm quite passionate about this topic, and I feel like I have a lot to say and a lot to teach. So I'm very excited about that today. Um, I also think that this is a pretty important topic because, you may have children that could develop allergies or have allergies now, or they could have friends and play dates with children who also have allergies, and you want to be prepared. You might work with kids who have allergies or be around kids in any setting. And, allergic emergencies can really happen at a moment's notice. So I think it's a really good and important thing to be educated on. You can really save a lot of lives this way. And so today I will be talking mainly about peanut allergies, but a lot of allergies present the same way. And so when I say peanuts, I'm talking a bit more of a broader category, but peanuts are the main allergen that causes a lot of the allergic emergencies that we see. All right, so to begin, I'm going to talk a little bit about how you get an allergy. So there is a genetic component to allergies. So you can inherit an allergy from, your parents, but it's not necessarily from the same disorder. So let's say your parents are, or if you yourself and you have kids, if you have asthma or hay fever or an allergy, you can pass it on to your kids, but it might not necessarily be the same allergy. So I'll be giving a lot of personal examples today just because I grew up with this, but my dad has asthma and he does not have any allergies, just asthma, but then I ended up with asthma and a couple food allergies. So um, anything like that can be passed on, just not the exact same thing. So if you have asthma, your kids might end up with, asthma or other allergies. So on top of genetics, environment also plays a pretty big role into how allergies develop. You might have heard of the hygiene hypothesis, and this is the theory that there is currently a major increase in allergies in well-developed countries that, we didn't have 50 years ago. And this is thought to be because of like excess cleanliness. And so typically our immune systems, when we grow up in 50 years ago, we grew up in a bit more like a dirty environment, I guess. And so your immune system got exposed to a lot more, foreign things. But now since we live in, housing, the housing got better and westernized countries are a bit more developed. We are exposed less to these foreign things. And so our immune system kind of gets bored and we start to react to harmless things in our environment. Another thing that they think has caused a lot of increase in allergies is there's increased consumption and exposure of children to peanuts and other allergens. So peanuts are a major food additive, and it doesn't seem like it might not say like a peanut butter bar, but they could be like an underlying ingredient, or peanut oil is used a lot in cooking. So that is definitely one of the aspects that has increased the prevalence of allergies. And finally, in our westernized countries, we actually eat a different type of peanuts. So, for example, here we dry roast peanuts, and so that is a much more allergic form, but they are boiled in other countries, and that is less allergic form. That's less likely to cause allergies. And so on top of those like components, so environment and genetics, that's kind of like predisposing you to an allergy. But once you have like I guess the factor or the gene that like causes you to have an allergy, you have to get exposed to a food allergen. So your first exposure to a food allergen, you actually won't have a reaction. So what happens is your immune system will like, let's say you eat a peanut or you get exposed to it in any way, your immune system will recognize it as foreign and it'll start producing antibodies against it, which binds to all of your immune cells. So there's no reaction yet. On your next exposure, however, your body has now kind of primed itself for an attack because it has all of these immune cells ready to go. And it produces a massive response in which you get these immune cells releasing all types of molecules that cause your allergic symptoms like itching, hives, swelling, nausea. We'll get into those symptoms later. But yeah, so that's essentially how your allergy starts. So first you get exposed to it, and then the second time you will have the reaction, and then you'll continue to have the reaction every time after that. So, and often this initial exposure is not recognized. So like often you can get exposed to peanut or nut antigens just through like creams. A lot of like creams and shampoos and soaps have, like almond oil or stuff, and that can be the first exposure. So you might have never fed them the nuts, but they have been exposed to it in a different way. So that's always important to know. All right, so next I'm going to talk about how the allergy actually develops in the kid. And so it's something called the atopic march. It's actually kind of a cool sequence, and I grew up having the sequence, so I have a lot of experience with this. But basically, allergies develop in children in a sequence that begins with eczema, you can call it either thing, then a food allergy, and then asthma, and then allergic rhinitis. So they're typically seen in that order. So we'll start with eczema. And so this typically begins between the ages of 0 to 2 years old, most often about 6 months old, but can be anytime within that range. And so what you'll notice in the baby is that they'll have this condition that makes your skin really red and itchy and very dry. It can often look scaly, and it can even crack and bleed. And I had it when I was a baby on my hands and my face, but it can be found almost anywhere in your body. It's quite itchy, so you'll notice that the baby will be itching at it. And this can self-resolve. So that is the first sign of the atopic march, the sequence in which you'll develop an allergy. And then the second sign is the food allergy itself, and this will also develop from 0 to 2 years old, the same time as the eczema. And so this usually occurs when food is ingested, but it can rarely begin when the mom ingests food and then it's passed through breastfeeding. So that can occur. And then typical symptoms of an allergic reaction is itching. So the kid will be maybe itchy in their mouth where they ate it, or they can get hives and rashes. And so they'll be scratching at their rash. They can also get swelling of their face. They can experience nausea, vomiting is a big one, cramps. They'll get airway obstruction, so they'll have a really hard time breathing. They can also have diarrhea, low blood pressure, and anaphylaxis. And so anaphylaxis is the severe reaction in an allergy that we focus on the most in, prevention and treatment. So what anaphylaxis is it's a severe and potentially fatal systemic allergic reaction. So that means it involves your whole body, and it occurs very suddenly after ingesting an allergen. It's up to an hour, but death can occur in minutes. And Canada does have a priority food allergen list, and I'll read it off. So these are the foods that are most likely to cause an allergic reaction, including anaphylaxis. And that's peanut, tree nuts, cow's milk, egg, wheat, soy, fish, shellfish, sesame seed, sulfites, and mustard seed. And so, of course, all allergies can present differently, but the features of an allergy that really indicate that it is likely associated with an anaphylactic reaction is the hives that I mentioned earlier. And so these hives should occur less than 1 hour after the ingestion of the food. And so again, these hives are like a raised white or red bump on your skin. I don't have hives right now, or else I would show, but it would also have redness around the bumps, and it'll be really itchy and burning. So you'll notice the kid will really itch at it, and they're really uncomfortable. They don't like it. And it can also present as angioedema. And so what this is it's not a rash on your skin, but it's like a swelling from underneath. So it's not red. Your skin is still the same color, but you get a really big swollen face commonly. You can also get conjunctivitis symptoms. So their eyes will get really red and puffy. They'll get abdominal discomfort. So they might be throwing up. They have big stomach cramps. They'll be wheezing, and overall mouth discomfort, like their mouth will get swollen. And the biggest, another thing we have to really consider in anaphylaxis reactions is that it can be a biphasic reaction. So although they have the initial reaction, they have to stay under observation for hours later, because you can actually have a second reaction within 2 to 12 hours later. That can be more severe than the first one. And it doesn't require, ingestion of the food again. It just, the body does it again. We're not really sure why, but it's definitely scary, and it happens. So it's a reason why children need to be observed afterwards. And we'll get into more of the treatment and prevention afterwards. I'm just running through the allergic sequence first, and then we'll get into more treatment and prevention. So I've talked about eczema, I've talked about food allergy, and so the next sequence in our atopic march that I mentioned is asthma. And so they will develop this asthma from the ages of 2 to 5. And this occurs when your airways swell. So your breathing tube, and you also produce extra mucus in there. So it makes it very difficult to get, air to your lungs. And so you'll find that the kids, they'll wheeze when they exhale. So it's not on inhale, it's only when they exhale. It's kind of if you haven't heard of wheezing before and you're interested, you can look it up on YouTube and hear what it sounds like. But when they breathe out, it's like you can tell that there's something that's keeping them from being able to breathe out. It's wheezy, and you can tell that they're they're having a really hard time breathing. They'll be really short of breath. They'll often complain of chest pain. And so they think they'll say, oh, my chest hurts, but it's their lungs. They can also have trouble sleeping. So if you notice that the kid is starting to wake up in the middle of the night from difficulty breathing, that could be a sign of asthma. And they're also especially affected by respiratory viral illnesses. So if they get a cough or the flu, you'll find that they'll get really, really bad coughs and really bad wheezing. So those are definitely important symptoms in asthma. Next, on the atopic march, and the last one, so we had eczema, and then they get the food allergy, then they get asthma. The last thing that they will develop is called allergic rhinitis, also called hay fever. And this will typically onset after 5 years of age. So they won't have it when they're younger, but once they, start school, you'll start to notice that they get runny nose, nasal congestion. They'll get really itchy red eyes. They'll sneeze. They'll be coughing. They'll often tell you that the top of their throat is really itchy. They can also be really tired. So there's a couple of signs that are really hallmark signs for allergic rhinitis or hay fever. And one of them is called the Allergic Salute. And so you might have seen kids who always, they'll sniffle like this. And that's called the Allergic Salute. And basically they push their nose up to raise their nasal passages to help them breathe. And then after a while, after they've been doing the Allergic Salute for about 2 years, they'll start to see a little ridge. So if you can see, they'll get a little line here, a permanent line, and that's called the allergic transverse nasal crease. And so that's a big hallmark sign of allergic rhinitis. They also can get shiners. And so if you ever see a kid who has really bad under eye circles, but they're not getting lack of sleep, that's often a huge sign of allergic rhinitis. And basically what happens is that, venous blood pools under their eyes. And with all the nasal congestion they have, it's not able to escape. And so they develop under eye bags, but it's not from tired or fatigueness. It's from their hay fever. And finally, another hallmark sign is nose secretion. So they should be clear or yellow in allergic rhinitis. If it's green, that is probably an infection. So it's always good to, take a look at their snot. But yeah, and it's not perfect. Obviously, sometimes it can look a little green or a little clear, depending on, it's not like a perfect delineations, but on average, it should normally be clear or yellow if it's hay fever. All right, so I've done a quick run through of eczema, allergy, asthma, and allergic rhinitis. So now I'm going to go into them one by one and talk about treatment and prevention. So first, I'm going to talk about eczema. So there's actually no cure, unfortunately, for eczema. It's really common in children. It's a lot more children have it than you think, but they can grow out of it. So you'll see it less in adults, but it also can occur at any age too. And so what doctors will typically prescribe is a corticosteroid cream. One of the brands is called hydrocortisone. You've probably heard of it. And so that helps repair the skin, but overuse can result in thinning skin. So make sure that you use it exactly as your physician prescribes it and only where they prescribe it. So for example, like some people will get eczema on their eyes, but your eyelids are very, very thin skin. And so you shouldn't be using, corticosteroid cream on your eyes. So make sure that when your physician prescribes it, that you use it exactly as they tell you to. And in terms of prevention, moisturizing does help, and also identifying and avoiding your trigger. So for me, my big trigger is the cold. So if I went outside and didn't wear gloves, my eczema on my hands would get worse. Some people's triggers also include like certain soaps and detergents, sweat, dust, and pollen, and it can also be triggered by eating certain foods like eggs and milk. So one of the really good ways to help prevent your eczema and make sure that it doesn't get worse is to really figure out your triggers. It can take some time, but once you make the connections, it can really make a big difference in the kid's life. And then next we have food allergies. And so food allergies can actually be tested for. There's a skin prick test that you can do where they take a patch of your skin, normally like your arm here, and they'll prick down your arm with different allergens. And if you end up with a hive, that means that you're sensitive to that allergen. It's kind of a cool test. It's not painful. It's small little pricks. They don't go very deep at all. And it's a really good way to see what your kid could be sensitive to, because some you might not have even realized, because it's hard to, detect certain allergens like pollen and things, but it's definitely a cool test. So that's an option. And in terms of treatment, so the main treatment for food allergies, especially anaphylactic allergies, is immediate administration of an EpiPen. And I actually have mine here today. So here's an EpiPen. They normally come in a yellow box like this. And if you ever see a sign of an allergic reaction in a kid, or if they aren't showing signs yet, but you know that they are allergic to a certain food and that they have just ingested it, you should always give epinephrine. And basically, it comes in a little bottle like this. And you take it out like this, and you might have heard the rhyme, blue to the sky, orange to the thigh. So you have this up and you take off the cap and you jam it into their thigh and you hold it for 10 seconds. So you don't jam it and pull it out. You have to hold it for 10 seconds so that the epinephrine in this EpiPen gets completely injected into the kid. And then while that happens, it's really important to have someone call the ambulance to get them to the hospital for further reaction, because as I said before, there is that biphasic reaction where they can actually get the anaphylactic shock again in a few hours. So anaphylactic shock is a medical emergency, and it's important to get them epinephrine as soon as possible and then get them to the hospital. Another thing to consider is that if you are far away from the hospital and that's only half an hour or more, they might need 2 to 3 doses of epinephrine. So if you have a kid with an anaphylactic allergy, it's always good to have more than one on hand, especially if you know that you are further away from a hospital. So if you live on the outskirts of a city, or if you are maybe like camping on the weekend, definitely good to keep more on hand, because you never know and you don't want to risk anything. And so prevention of allergies, this is not prevention of developing the allergy, but prevention of getting a reaction. And so this is a bit of a more difficult thing because often, the allergen that you're allergic to is quite widespread. So for example, like me being allergic to peanuts, peanuts are in a lot of foods and a lot of candies and chocolates. And so ultimately the prevention is total avoidance of any product with peanuts. And that includes products that say may contain nuts, because the amount of allergen that it takes to produce a reaction is actually quite small. And so these may contain warnings are actually, they're there to protect you. And so it can be difficult to try and find the right products and like make sure that they don't have your allergen in it. So one thing that's always good to do is to do your research and find the right brands that work for you. One brand that I really like is called, I think, Made Good. It's peanut free, it's nut free. It also is a couple other allergen frees. Do your research and find the snacks that are, are safe. There's also a lot of like peanut free signs on a lot of snacks that are there, and they're like, they're checked and they're verified, so you know that they're safe. And that's specific for peanuts, but there are other allergens, and they also will let you know if they have the allergen in the food or not. So that's really important. It's also important to get your kid to be good at reading ingredients in all their snacks so that they know how to find whether their allergen is in the food that they're eating. Another thing that is good in prevention of an allergy or an allergic reaction is that while peanuts are not necessarily a nut, they're technically a legume, but 40% of people who have peanut allergies actually develop another allergy, and the most common one is tree nuts. So often physicians will tell you if your kid has a peanut allergy to also avoid tree nuts as well. Yeah, so I think that is about all the important things in prevention of an allergic reaction. And then we have asthma. And so asthma can be treated with a couple of things. I have it here. Yeah. So the first thing that you will see with a kid with asthma is they'll have puffers. And so here is what a puffer looks like. It's like a little spray. And basically this, the one that kids will commonly carry is their quick relief one. And so this is called a bronchodilator. And this is one that rapidly eases their symptoms. And so how do you administer this to a kid? It's actually, there's a certain way you have to do it or else the medication won't work as well. So first you have to shake it. And then you get the kid to exhale completely. So you ask them to breathe all the way out. And once they've breathed out, then you take the inhaler, you take the cap off, and you put it, and you get them to wrap their whole mouth around it like this. And then you get them to breathe a little bit in. And as they start to breathe in, you spray the inhaler, and then they breathe it all in, and then they have to hold their breath. And this is the important part. They need to hold their breath so that the medication actually, reaches their lungs, because if they breathe out too fast, then they'll be breathing out the medication. So first you shake, you get them to exhale, and then they breathe in, spray, and then breathe all the way in, hold it, and then they can exhale. Hold for about 10 seconds. If that's too long for them, as long as they can. So this is their like symptomatic puffer, but they also might have a second puffer, which is the steroid puffer. Sometimes it's red. It can change colors depending on the brand. And that can be used in combination with their symptomatic puffer, depending on what they got prescribed by their doctor. So just ask what the kid uses and make sure that they're using it as prescribed. Usually it's daily, but it can depend on, of course, the severity of their symptoms and what their doctor has told them. All right, so prevention of asthma, of course, it's one of them is to always keep your medications on you and take them as prescribed. Another important aspect is actually to get vaccinated for the flu and for pneumonia, because those are two respiratory illnesses that can get really, really bad for kids with asthma. They get really bad wheezing, really bad coughs. They have a lot of difficulty breathing when they get sick with the flu or with pneumonia. And then finally, you can also identify and avoid your triggers. And so some people have exercise-induced asthma. So there might be certain sports or certain environments, like especially playing sports in the cold, can often make asthma much worse. There's also occupational asthma. So there's certain, exposures and like different toxicants that you can find in like certain occupations that can make asthma worse. And there's also allergy-induced asthma, and that can be from pollen, from like pet dander, like cats and dogs and things like that. All right. And then, so asthma, we've done that. Next, we have, and the final one is allergic rhinitis. And so this can also be tested with skin prick test that I talked about with the allergies. And so that's to see if they're, reactive to any tree pollens, flower pollens, things like that. And so the treatment for this, there's a few things you can use because unfortunately, this isn't something there's no cure. So there's just different things that are aimed towards symptoms. So there's nasal sprays, and these essentially lower the inflammation in your nasal passages and lowers the itchiness. So it's definitely very helpful for their symptoms. There's also antihistamine pills, and I have some here. You can use Benadryl. And basically what these do is they're called antihistamines, and something that your body does in an allergic rhinitis reaction is it releases histamine, which is what causes like itchiness, the swelling of your nasal passages, and a lot of like the buildup of like snot and congestion. And so these relieve it. But these, some of them can be drowsiness causing, and so you can also get non-drowsy ones. I have so many of these, but of course, take them as prescribed by your doctor or read the instructions because these are over the counter. They're not prescription. But talk to your doctor first about whether it's something that would be helpful. And normally they're taken daily. So that's treatment. And allergic rhinitis prevention, again, let's always know your triggers. So it can be seasonal. And so if you find that your allergic rhinitis symptoms are seasonal, it's probably from tree pollen or grass pollen. If it's year-round, it can be something like coming from pet danders. I myself am allergic to animals, so mine is year-round. And I find that taking these pills even a few days before seeing animals, that helps a lot. And what else is there? There's different ways that can help lessen your exposure as well. So the first is to, if you're allergic to the house pets, you can remove or limit your exposure to house pets. Of course, this can be difficult, especially if the house pets belong to you because you don't want to get rid of them. You love them. So I think vacuuming your floor is definitely very helpful. Keeping the pet from being in the room of the person who's allergic can be a big difference so that they're not breathing in the dander when they're sleeping. A big thing is also changing your filters and your air conditioner and your the air conditioners in your home more often can make a big difference. And also avoiding irritants like cigarette smoke and strong smells like perfumes. Those are also triggers. I think that's a good overview. Yeah, so we've talked about the symptoms, prevention, and treatment of or atopic March, so eczema, food allergy, asthma, and allergic rhinitis. And I also have some common misconceptions that I could talk about real quick, like some common FAQs people have. So the first is, can you get an allergic reaction from the smell of food? And so you actually can't. However, you can get it. It still can be an airborne allergy, but the smell of food itself will not cause the allergy because the smell of food comes from volatile organics. But you can get an allergic reaction from aerosolized food. So for example, if you're boiling or cooking it and it sprays and the person, breathes that in or ingests it in some way, that actually can cause an allergic reaction. So that's definitely something to consider. Again, can you get it from eating a food product that says may contain traces? Yes. So it's definitely important to always read the label before you eat any snacks. And then another thing is, how do you recognize when something is or isn't an allergy? And so some features that are not an allergy is if you get the reaction for a continued period of time. So for 24 hours or more, that continues to worsen, that's less likely to be an allergy because an allergic reaction is typically really fast onset within an hour of eating and lasts about 8 hours maximum. And finally, you can get hives from something that isn't an allergy. So often, perhaps you've experienced this before, after a viral illness, you can get hives afterwards. And so that wouldn't be considered allergic hives. That would be viral hives. I think I've completed everything I wanted to talk about today. I'm going to look through the comments. What age do they do the prick test? So there's no age or specific time that you need to get a prick test. like I could go and get a prick test now if you're 60 years old and you find that you started noticing you are getting, hay fever, or you start getting, congested and sneezing a lot and red eyes. In the spring, you can go and get a prick test to see if there's certain pollens or danders that you're allergic to. So there's no age where you can or can't get a prick test. Great. Thank you everyone for coming and watching. I I'm very passionate about allergies. I grew up with them my whole life, and it's definitely something that's difficult to deal with, but it makes you feel a lot safer when you're a kid, when you know that the adults around you are, well versed in how to treat allergies, how to give an EpiPen, and um, it's good to be educated on this kind of stuff, because especially with the increasing prevalence of allergies lately, it's definitely important to know, and it could save lives. So um, yeah, I think it's a great thing to be educated on. Why does the allergy become more severe every time you're exposed to it? Well, that's a good question. So basically, what happens is every time you eat an allergen, um, I won't get into the nitty gritty science of it, but when you eat an allergen, your body produces more and more antibodies against it. So each time you eat that little like piece of peanut, your body will produce antibodies, and the more antibodies that are produced, it'll bind to more immune cells. And each time the immune cells see that food allergen again, they release all the histamines and all of those little molecules that cause all of your crazy symptoms like anaphylaxis, the hives, the itchiness, the vomiting, the abdominal discomfort. So it does get more severe every time you're exposed to it, and that's why it's really important to lessen your exposures to allergens. Thank you for asking. It's a good question. My doctor doesn't seem to want to do the prick test on my 2.5-year-old. How come? Oh, I don't have an answer for you for that. I'm sorry about that. I'm not sure why they wouldn't want to do a prick test on your 2.5-year-old. Um, I'm only first year medical student, so um, I'm not sure about any contraindications that could be with a prick test, but um, perhaps he wants to wait for the child to get older. You could talk to your doctor for sure and ask them why. I'm sure they would be happy to let you know the reason why they don't want to give your child a prick test. I should look into that though. Thank you for bringing that up. I would be interested to know why. I didn't realize that even after giving an EpiPen shot, you have to call emergency. I'm guessing this is always true. Yes, this is always true. And this is one, because the EpiPen itself isn't um, like a treatment. It's more of a emergency use, just to keep you alive until you get to the hospital. Once you get to the hospital, they'll give you more things. They'll give you antihistamines. They can give supportive therapies like maybe IV fluids if you need more, or oxygen. They can make sure that your airways stay open too. So one thing you get an anaphylactic shock is your airways become compromised from a lot of swelling. And then there also is the biphasic reaction I talked about earlier, where you can get a second reaction. Like it doesn't require another exposure to the allergen. It's just something about our immune system. We don't know why it happens, but sometimes after an anaphylactic reaction, it can happen again 4 hours later. So that's why you need to go to an emergency room so that they can observe and make sure that you're safe. Yeah, no problem, Josie. Yeah, it could be because he's too young. I'm not sure about the exact ages of the allergic skin prick test. Definitely talk to your doctor and they'll be able to tell you um, if it's the age, and then they might be able to tell you maybe at what age that he is able to get one. If anyone else has any questions, feel free to send them in the chat. I'll monitor for a little bit more, and then we can call it a night. Yeah, that's why they keep you for around 4 hours. Yep. Yeah, of course. It's definitely scary to be a parent whose maybe kids don't have allergies, but their friends do, because you might not have been, educated on that. Because of course, if you have a kid with allergies, your doctor's made sure that you know how to treat it, but they don't often teach you if your kids don't have allergies. So it can make you feel a lot better when you have kids who are visiting and they have an allergy and you know what to do. Thank you, Josie. All right. Um, I'll let you guys all go now. Thank you so much for coming. I hope you guys have learned a lot today, and I hope you guys will be ready for any potential allergic reactions you might encounter, or be ready to recognize the signs in any kids that might be in your life so that they can go and visit a physician and get the treatment that they need. All right. Thank you so much. Bye, guys.